This video, we're going to take a look at Chapter 19, which is still dealing with cardiovascular system, the heart. Objective 9, which is the effects of exercise on cardiac output and heart rate. Honestly, you should be able to know the answer to this from the previous section, but just in case, cardiac output is going to increase in a person who exercises since their heart is efficient at moving blood. Now, I did put down here so y'all would remember the definition of cardiac output and the formula for cardiac output. So the definition again is the amount of blood pumped by each ventricle in 1 minute. Remember, there's a time component for cardiac output because it is heart rate times stroke volume. Heart rate is the time component, it's the number of beats per minute, right? So cardiac output is going to increase in a person who is exercising since their heart rate is more efficient at moving blood. So if you look here, you've got a trained individual, someone who exercises on a regular basis, and their cardiac output is high, and that's what you would expect in a trained individual. In an untrained person, in comparison, their cardiac output is not as good. And then at rest, your cardiac output obviously is going to be low because you're not doing a whole lot. During exercise, the sympathetic nervous system is going to result in an increase in heart rate due to the presence of epinephrine and norepinephrine. And as you remember, increased heart rate is going to result in increased cardiac output. The more fit a person is, the lower their resting heart rate will be. So you have an untrained individual, and this is their heart rate. This is a person at rest versus a person who is exercising, who is untrained. And then you have, look at the heart rate of a person who is trained, and their resting heart rate is lower, but so is their exercising heart rate. And that's all of objective number 9. That one was short and sweet.